Well, the doctor is in, fully clothed, ready to be with us. Dr. Scott Kirby is a cardiologist from Cardiology Associates, and he joins us today to, we're not going to talk about that heart-stopping incident that happened at the airport there in Florida.
Good, we'll skip that.
But we are going to talk about heart rhythm disorders or irregular heartbeats.
Correct.
And how common is this?
Very, very common. All of us have up to even 250 extra beats per 24 hours can be normal. Different people sense them different ways. Many are not dangerous, but some may be, even leading to serious complications such as a stroke. So we need to be aware of extra heartbeats and pay attention to them and not ignore them.
Wait, how do we know if you said a lot of us have extra beats,
right.
How do we know when we need to go see a doctor?
Usually as we get more birthdays under our belts, as we get into our 60s and 70s, these extra beats can be not benign, can be more dangerous. So as we get older, we need to pay more attention. And about 1 out of 10 people over age 70 has a rhythm called atrial fibrillation, and 2 out of 10 over age 80. And this rhythm is a direct cause of stroke.
Right.
So we really need to pay attention to that.
So what can you do about atrial fibrillation?
Atrial fibrillation, if it is diagnosed, needs to be assessed. You need to be on blood thinner to, of course, when the heart is fibrillating or shaking, it's not beating and washing the walls off, so in the corners and edges clot can form. So a blood thinner can protect you from those clots breaking off and causing a stroke. Certain medicines can slow the heart rates down to make it more tolerant. We have certain medicines that can restore a normal rhythm, and then where I come in as an electrophysiologist is doing procedures to actually fix those rhythms.
Okay, so you go in and kind of shock the heart, I guess, back into rhythm, or is that what you do?
We can use it's called a cardioversion.
Mm-hmm.
We try not to say shock, but we do make
that's
them...
a little shocking to people when you say that.
Right. And we do make them sleepy before we use any
Right.
type of electricity, but we can depolarize or reset all the cells to allow the normal nerves to take back over. But my procedures, we actually use radio frequency or microwave type energy to find these little areas that have been activated and eliminate them and fix the problem.
And so this is a very prevalent problem, a very common problem to have an irregular heartbeat. So we want to get people to ask you questions. So even if you're not a patient of Dr. Kirby's and you have a question about your heart, an irregular rhythm, irregular heartbeat, or really any other heart questions that they might have, we are going to be on Facebook Live right at 12:30. So we want you to log on and type in your questions. Dr. Scott Kirby has been generous with us, and he's going to stay with us right at 12:30 to answer your questions about your heart problems. Dr. Kirby, thanks so much.
Thank you.